Doreen Granpeesheh is the
Dr. Doreen is an expert in autism.
Doreen Granpeesheh.
Dr. Granpeesheh.
Dr. Doreen Granpeesheh.
Dr. Doreen Granpeesheh is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen. Now, Sadaya has written in and said, thank you for your brief answer earlier. They want you to please say something about, they wrote Apraxia, but I think, Sadaya, correct me if I'm wrong, you mean Apraxia, and how ABA can help with that, or who or which specialty of doctor can rule out that it is motor planning and processing. My son is struggling.
Yeah, that's a great question, Sadia. So apraxia is basically the low muscle tone in the tongue and mouth. So a lot of times when our kids have a hard time producing speech, they might get a diagnosis of apraxia. And believe it or not, both speech therapists and ABA folks, behavior technicians and behavior analysts, can help with apraxia because it is about motor planning, oral motor, but it's also just practice. It requires practice with various facial and oral motor exercises. So in our curriculum that we wrote up on skills, there are a ton of different exercises that have to do with the movement of the tongue, right? Like sticking out your tongue, moving it to one cheek to the other, trying to touch your nose, trying to move your mouth in different ways in imitation of ooh, ah, those types of things in front of a mirror. You can use objects like a lollipop to get the child to bring their tongue out, to move it around, and those types of things actually help pretty significantly, because if you think about it, look at just when you say one sentence, right? Look at how many different ways, pay attention to how many different ways not only your mouth moves, but also your tongue. Like every letter, your tongue is constantly moving from one side to another, touching the top of your mouth, and that's what's difficult for our kids because the muscle tone is low. There are also, so usually I don't know how many ABA specialists are really good at these exercises, but speech paths are very good. They will give you a ton of exercises to do. You can actually look up on and Google like exercises for apraxia, and you can find some of those things. And there are also websites that will help you order resources for this. For instance, there are little vibrating, they look like they're called Nook brushes. They're similar to a toothbrush, but a little bit different. And you can even use an electric toothbrush, but it's about stimulating the nerves inside and around the mouth regularly. And then hopefully you'll see a little bit of improvement in the muscle tone and in the movement and motor planning. And then that helps the child put together sounds and then words and then effectively communicate. It also has to do with production of air. So it's not just these movements, but I would really suggest you maybe have a consult with a speech pathologist and they can get you going on some of these exercises.
Yeah, I want to say that in the last 10 years, apraxia was being diagnosed much more because people were getting more specific with the diagnosis. And it certainly felt like to me, Dr. Granpeesheh, that a lot of ABA people, there were some who were really good and some who were like, yeah, we don't know much about that. And a lot of those people were moved to devices, which isn't necessarily a bad thing in the interim because we want to give everybody functional communication, because it seems like with apraxia, it just takes so much more time and practice,
Yes.
as you were saying. But I just want to put it in everybody's bucket that I know two moms who said, oh yeah, no, this is not about giving up. We're going to use our speech devices, but we're going to continue with all of and you said speech path. For people who don't know that, that's a speech and language pathologist. And most schools have one at the school, right? So, but I know at least two moms that just kept on it. And one of them, her son is and in college, and the other one they just took him. He was considered nonverbal, and he is no longer considered nonverbal because he has enough language that he is considered a verbal person. Both of them with a diagnosis of apraxia, both of them with parents who said, we are not giving up on this. So I just want to put that hope in
And
people.
it's not uncommon. I just want our parents here to know that apraxia, I probably give or see a diagnosis of apraxia with more than half of our kids, like 60-70%. So don't let it scare you. Just, it's just one other thing to add on to the treatment, and it's not something that doesn't change. It does.
There we go. Thanks for watching Autism Live. If you found anything helpful in this video, please give us a like. In fact, make sure that you smash that subscribe button on YouTube and give us a like on Facebook. You can also follow us on Twitter and Instagram for important updates. And please download our free podcast wherever you get your podcasts. See you next time. Until then, give your kiddos a hug from me and one for you too. Bye-bye for now.
To subscribe, click here. And if you'd like to check out some more of our videos, click here.